Again, ladies and gentlemen, thank you for joining us here from the Wood TV Live Desk. My name is Luke Laster. New restrictions set to take place on gatherings in the state of Michigan. As you just heard there, press conference about to get underway in less than a minute. We will take you there live when they start speaking again, as you can hear some of the background noise from that feed there. Again, new restrictions on gatherings. We'll have Dr. Joni Khaldun, as well as some others, making comments on these new restrictions. You can find all this information right now in the link on this post, actually up on woodtv.com. Effective immediately, indoor venues without fixed seating must limit those gatherings, such as weddings, parties, banquets, to no more than 50 people, down from the maximum of 500. Again, an update there, as you can see on your screen, about to be underway.
All right, why don't we go ahead and get started. Again, my name is Ray Bachnight, Director of Communications for the Michigan Department of Health and Human Services. Thank you for joining us this afternoon for another COVID-19 update. We are recording this for your awareness. We will begin the program with remarks from Dr. Khaldun. Following, Director Gordon will provide remarks, and we'll allow time for Q&A. If you could put your device on mute until we get to the Q&A portion. And once we do get to the Q&A portion, please use the raising hand function in order to ask your question. We will address those questions in the order that appears here in the Teams function. We're planning to wrap up right around 3:45 for your awareness. So we'll try to get to as many questions as we're able to within that time frame. Before we get started, I did want to acknowledge, as you're aware, we often provide updates to data on our website at around 3 o'clock. Today's data update is a bit delayed. We're aware of that, but due to technical difficulties, but of course working to get those updates made. So just stay tuned to see the data update reflecting today. So again, please mute your devices on your side. We're going to go ahead and get started into this conversation. I'm going to toss it to Dr. Khaldun to provide a public health update. Dr. Khaldun?
Thank you, Ray. Good afternoon, everyone, and thank you for joining us. So yesterday, we announced a total of 167,545 cases and 7,257 deaths due to COVID-19 in Michigan. We are at a critical time in this pandemic. We are now in the midst of another surge in cases. We are identifying more cases daily than we were at our first.
All right,
in April.
We'll talk soon. Thanks, Linda.
I'm going to ask everyone again to mute your microphones, please. Our overall case rate in Michigan is at 172 cases per million people per day. That has been increasing for 6 weeks. Our 7-day average for cases is more than 2 times higher than it was a month ago. What's good is that we continue to do well with our testing. So our testing numbers are increasing steadily, and we are at about 4,000 tests per million people per day. We averaged 41,000 daily tests last week and are testing just under 3% of our population a day. However, our percent positivity is also continuing to increase, and we are now at 5.5% for percent positivity, and that rate has been increasing for 4 weeks. This increase in positivity, excuse me, indicates that we are seeing ongoing general community spread of the disease. Now, every part of the state continues to look a little bit different, but all regions are seeing an increase in cases. The Upper Peninsula has our highest case rate at 428 cases per million. They also have the highest test positivity rate at 7.9%. Kalamazoo has the next highest rate for both at 266 cases per million and 7.4% positivity. The Grand Rapids region is next with a rate of 208 cases per million and percent positivity at 6.3%. The Traverse City, Detroit, Lansing, Saginaw, and Jackson regions those case descriptions are shown here in this slide. They all have a case rate between 122 and 162 cases per million and positivity rates between 3.4 and 5.3%. Hospitalizations also continue to increase in every region of the state, with the most rapid increase being in the Grand Rapids and Detroit regions. With the exception of the Traverse City area, 5 to 10% of the inpatient beds in the state are being used to treat COVID-19 patients. As hospitalizations go up, we expect our deaths to go up shortly thereafter, and that's exactly what we are seeing. Our current 7-day average for deaths is increasing. On October 25th, that 7-day average was 19 deaths, twice what it was a month ago. We are also identifying more and more outbreaks. Last week, we identified more outbreaks than we have since we started tracking. There are 446 new or ongoing outbreaks that our local health departments are investigating. Top categories are long-term care facilities, K-12 schools, manufacturing, construction, and social gatherings. The good news is we are doing well with our flu vaccinations this season. So we set a goal at the end of the summer to achieve 4.3 million flu vaccinations this year, which is 33% more than we did last year. I'm pleased to say that we are already at 45% of that goal, and we continue to partner with pharmacies, clinics, and community-based organizations to expand access to vaccines, flu vaccines across the state. So overall, I'd say that the trends we are seeing are incredibly concerning. Cases, hospitalizations, and deaths are all increasing. And unless we all change our behaviors now, that will continue. So we have to avoid indoor gatherings as much as possible, wear masks, and maintain 6 feet of distance. If you feel sick, don't go out, and get a test, please. This will be even more important as we go into the holiday season. So to talk a little more about what we're doing at MDHHS, I'm going to turn it over to Director Robert Gordon.
Thank you, Dr. Khaldun, and good afternoon, everyone. As Dr. Khaldun said, this is a very dangerous time, and as rough as things are, if you look west to Wisconsin and the Dakotas or east across the Atlantic to France or Spain, you know that the numbers could go much higher yet. The only way to beat COVID is to act on what we have learned already. Today's orders establish new requirements and set up a path for enforcement. But the heart of our effort to beat COVID will be in the hearts and minds of individual Michiganders of every race and politics choosing to protect human life and to act on the science. We have done it before here, and we know we can do it again. The focus of today's orders and our guidance is social gatherings. This includes weddings, parties, casual meals at home or in restaurants, and people just hanging out in these different settings. Currently, Michigan counts 34 outbreaks related to social events such as trips by families and friends, bridal showers and weddings, funerals, and outings at social clubs and bowling parties. An additional 19 outbreaks are linked to church services, which are exempt from enforcement under the order today. So the first thing that the order does is to reduce the number of people who can be present at an indoor gathering in a non-residential setting without fixed seating. So this is things like banquets, weddings, conferences, and so on. The focus here reflects the particular risks in these settings around people moving around, chatting, dancing, eating, drinking without masks on. The number of people in a gathering matters enormously. First, because the more people who are together, the greater risk that there is one person who has COVID and is contagious. And second, because if that person is there, the more people who are present, the more people can get COVID. So today's order reduces the maximum number of people in these settings from 500 to 50. I should note that states like North Carolina, Massachusetts, and parts of Illinois currently have similar limits, many others as well. Second, the order limits the size of tables in restaurants, bars, and the kinds of social gatherings just discussed to 6 persons per table. The logic here is the same. The more people who are there, the greater the risk that someone has COVID, and the greater the number of people who can be infected. Other states with similar table size limits include Wisconsin, Illinois, Iowa, and Washington. Third, the order requires bars and restaurants to begin taking names and phone numbers in order to facilitate contact tracing. This means that if there's an outbreak in a restaurant and staff have tested positive, public health professionals can reach out to people who are in the restaurant and let them know so they're able to protect themselves. The order brings the entire state into stage 4. Previously, the Traverse City region was in stage 5. This reflects the growth in the number of cases in Traverse City, as Dr. J described, and it means that now gathering limits statewide are the same and that children in schools statewide are required to wear masks. Violation of the order can be a civil or criminal violation. The civil fine is up to $1,000. The criminal penalty is a misdemeanor, punishable by up to 6 months in prison. Our strong preference, and that of our law enforcement partners, is education and voluntary compliance. Nobody is wanting to punish, but penalties are available as a last. Finally, I want now to share some the guidance that we're putting out. Actually, before I do that, this is just a slide that shows, again, the summary of what is in the order. This is the same slide we've shared previously. You'll see in the orange-brown new provisions that are changed in this order from prior orders. I want next, and before going to questions, to just take a minute with the guidance that we are also putting out today. I talked at the top about how fundamentally our success here will not be about orders. It will be about people making decisions to be smart and to act on science. The science here is clear. It is not speculation. Masks are protective, but only when you're wearing them. Physical distancing matters. Being outside is far safer than being inside. The bigger the group you're in, the more risk that one person has COVID and more others can get infected. Ventilation matters, voice level matters. And you can see here in the guidance that we are sharing today, those principles reflected. This is guidance around how we strongly urge people to act when it comes to social gatherings and decisions around getting together with family, including around holidays like Thanksgiving. We urge folks to get together outside whenever that is possible. The risks are much higher inside than outside. If you are inside, include no more than 2 households and never more than 10 people. If someone is sick, they absolutely should not be present. It's critical to wear a mask and only to take it off when you eat or drink, and then to put it right back on. Social distancing, limiting the amount of time that you spend with others in indoor settings. The more you work together, the more risk there is. Voice level matters. Makes a big difference whether people are speaking quietly or they are yelling or cheering. And it continues to be important to wash hands regularly and not share utensils. After gathering, if someone finds they're sick, they should get tested, and if they're positive, alert, or even when they're symptomatic, alert others who are present. With that, we are happy to take questions.
Great. Thank you, Dr. J. Thank you, Director Gordon. We'll now accept questions in the order that we received them. Again, if you could utilize the raising hand function to allow us the chance to identify the questions that might be out there. Please, unless you are speaking, keep your device on mute. But of course, for those who have the question, feel free to unmute yourself. All right, we'll go ahead and begin with Beth LeBlanc.
Hi, Dr. Gordon and Dr. Khaldun. A quick question. Do you feel that these measures are enough to curb this really rapid spread, or do you anticipate further restrictions will be needed in the coming days?
If people do what they need to do and follow not just the orders, but the guidance in this that we've released today, we believe we can get the number of cases down.
All right, next question. We have a question from Rod Baloney.
Yes, Director Gordon, just curious, when asking restaurants to take names and phone numbers for contact tracing, I'm just curious about, one, whether they will be required to do that. If they don't, what is the penalty? And third, what is the fine line between civil liberties and protection from the virus?
And so I said,
This is an order, so these are requirements. We're talking about businesses, restaurants, bars that are already regulated businesses that operate under a lot of rules, and they operate under those rules to protect public health so that they can operate and so that all of us can be safe.
Again, a reminder, if you're not asking a question, please go on mute. Next question, question from Dave Boucher. Dave?
Hi, thank you. Director Gordon, much of what is in this order was already in the order that you issued earlier this month, and as you, as Dr. Khaldun note, case rates are still going up pretty drastically. Do you think that businesses and people are not following the orders right now? And what impact do you think Election Day will have on the possible ongoing spread of the virus?
I think the way we will succeed is if all Michiganders do their part. And that's why we're talking not just about orders, but also about people doing the right thing for themselves, for their loved ones, based on the science. If people do that, we have successfully in the past brought the number of cases down, and that's the way that we can bring cases down again.
Right, we'll now take another question from Chad Livengood.
Director Gordon, do you think your epidemic orders, the powers under the Public Health Code give you the power to issue quarantines either at the county or regional or statewide level?
I think everything in this order is well within the epidemic authority of the director of the Department of Health and Human Services. This was an authority that was put in place by the legislature after the Spanish flu, after a time when the health department had issued significant numbers of, when there had been significant public health actions. I think if you look at the history, not only here, but around the country, public health departments take action to fight epidemics, including around quarantine and isolation. This is what public health departments do during epidemics.
But does this give you the power to issue a quarantine or stay-at-home order at any level? City, county, regions, the whole state?
I'm not going to get into a lot of hypotheticals. I will say that what we are doing is entirely in line with, as you know, what is going on in states around the country and with longstanding history around the response of public health authorities to epidemics. There's an old line: the Constitution is not a suicide pact, and public health departments exist to enable people to survive in these very difficult times.
Well, now move on to the next question. Next in the queue is Mike Wilkinson. Mike?
Hi, thank you. Currently, the state reports school outbreaks by both the number of outbreaks and the number of people who are infected. It's somewhere around 80 outbreaks and over 4,000 people. With the social gatherings, you mentioned there were 34 outbreaks. Can you give us some perspective? How many people that involves? Is it a couple dozen? Is it a couple thousand, if you know?
Sure. So among the 34 for bridal showers and weddings involved 3 to 10 cases. Funerals involved 9 to 22 cases. Other types of outings involve 6 to 19 cases.
Thank you.
And I should have also mentioned the press release, which all of you should have received. If you did not receive the press release we sent out moments ago, please contact Lynn Sutphin We also have information related to the outbreaks in that press release as well. Next in the queue, we have Kim Russell.
Hi, my question is, do these limits on social gatherings, the numbers, impact polling locations, ballot tabulation centers, anything that has to do with the election?
We are committed to ensuring that election operations are able to continue as necessary, and we'll work with the Secretary of State to ensure that that happens.
Does that mean that there could still be some impact with these orders, or it's in the works?
I would say we will make sure that we will make sure that they are able to do their work in the way they need to do their work. Obviously, I actually think that there's an explicit there's an explicit limit in the gathering limit for election activities. So it's actually explicitly covered and exempted. Should have caught that to begin with. So there's your answer.
Right. And before accepting multiple questions from an outlet, we'll first jump to the last two. There are two others in the queue that haven't, and then if we're given time, we'll jump back to you, Beth. So next in the queue that hasn't asked the question is Jonathan Elsting. Jonathan?
Thank you. I just wanted to follow up on Chad's question on Director Gordon. You said, the state has brought down cases before, but it did so with quarantines, with a stay-home order. Why are you not considering that kind of measure at this point, considering the case rate is, quite high compared to where it was in March and April?
I guess I'll just, thanks for the question. We are taking targeted actions via the order to address areas that are particularly severe sources of spread. And we are issuing guidance that is a very clear roadmap for what we need to do to bring cases down. And if all Michiganders can honor that guidance and make those hard choices, we can bring cases down. I can't tell the future about where we will be in the future, but those are the actions we are taking now. And I do believe that if all Michiganders follow that guidance and follow these orders, and we get robust compliance with the letter of these rules and the spirit behind them, we can get cases down.
If I could follow up, I'm just wondering, have you learned that perhaps a different approach is, different approach, more targeted approach is a better way to proceed right now than it was early in the pandemic?
I think we know so much more now than we did in March. We know about the power of masks, and that enables people to engage in a range of activities that weren't possible then. So I do think we are better positioned by the science and by experience to live fully, or to live more fully, in a way that we couldn't in March.
All right. And we're going to work to wrap up with the last few questions we have here. First, going to those who haven't asked questions yet. Next, we have Mid-Michigan Now.
Yes, hello, this is Dave Bondi with Mid-Michigan Now. You can hear me okay?
Yes, we can.
Okay, question. Out of the cases we see every day being reported, is there a way to tell how many of the reported positive cases are asymptomatic versus people with symptoms? Is there a breakdown of that available at all? And if not, why not?
Yeah, I can try this one. Yeah, so we do get the information automatically on the positive cases. It is the local health departments who will go back and do that case investigation work. Sometimes people are asymptomatic. Obviously, sometimes they have symptoms. I do not have that information at this point. We can follow up, but I do not think we have a way to definitively say for every single case whether they had symptoms or not, and to gather all that information in one place.
Gotcha. And real quick, it may be in the email, but I haven't seen it yet. Sporting events. How does any of this impact sporting events? And if you have addressed it already, I apologize.
Most sporting events have, most sporting events have, in a stadium would have fixed seating, and indoor and outdoor fixed seating events are not affected.
Thank you.
All right, just with the few minutes we have, just a couple more questions. Next, Kylie Ambu.
We've heard over the past few months, if people can wear masks and distance and do all of these safety precautions in X number of time, we could see better results. Do you have a timeline that you're looking for in placing these new orders that things might seem to turn around?
I don't. I think we're going to have to, we review the data on a regular basis, and we're going to have to do that. And so, it is, I've said that it is our hope that if people robustly follow these orders, that we will begin to see a turn. And if we don't, we're going to have to see where we are.
All right. And then the last two questions we had, as we are wrapping up, we'll just accept the last two. One from an individual hasn't asked a question, and then Beth will come back to you. The others we'd be happy to address offline. So David Edgar, I don't believe you asked a question yet, so please go ahead.
Thanks. Wanted to ask, in the spring, the state restricted medical procedures at hospitals to essentially essential procedures. Is that something you may look at here to free up beds in hospitals?
So that's a great question. We are working very closely with our hospital partners, regular communications with them about their hospital operations, what they're seeing on the ground. It's really important that we work closely with them because they understand what they can do as far as shifting their beds around and staffing. We do not want to go back to a place where hospitals need to limit their non-time sensitive procedures. We want people to get their vaccinations and their routine medical care for diabetes and high blood pressure. So we are continuing to work with our hospitals to make sure they have sufficient capacity. We are not at the level where we were in the spring. The hospitalizations look different. We're most of them are actually outside of Southeast Michigan at this point, but we are continuing to look at that and work with our hospital leaders.
All right, and this is the last question, given the time. Beth LeBlanc, please go ahead.
Thank you, I appreciate it. Yeah. Did you guys have any talks ahead of this order with like the restaurant association? Did they collaborate at all in these plans, or are they aware that the plans came out?
Yes, they're aware. So just, if I could just say in closing, just one last thanks all for coming and listening. Like, closing thought, anytime a person is inside with folks outside their family, they should be wearing a mask. And if they take it off, they should take it off for the shortest possible time and be aware that while it's off, that's a period of risk. And they should do everything in their power to honor 6 feet of social distancing. And it means that every time you're going into a setting with people outside your family, outside your home, and you're going to be near to others, it's something to think very hard about, because we're in a moment where there's a lot of COVID in Michigan, and those settings are creating a lot of risk. So we got a lot of rules in this order. We have very clear guidance, but ultimately we need people to be smart, to follow the science, protect themselves, their families, and all of us. Thanks.
Great. Thank you, Director Gordon. Thank you, Dr. Khaldun, for joining us. The press release did just go out moments ago, so you can find plenty more information there. Included in the press release, you'll find an infographic, a fact sheet, and additional information as well. So to everyone who joined us this afternoon, thank you again, and we will be in touch. Have a wonderful afternoon.